Welcome to the 2020 Public Health Law Virtual Summit. We have two presentations in this session, and each presentation will be followed by a Q&A. Use the chat feature to submit your question. If you encounter technical difficulties during the summit, go to the navigation menu and select the Need Help button. Now I will turn it over to our first speaker.
Thank you. So we'll start with introductions. My name is Carrie Wagoner, and slide please. And I am a senior attorney with the Mid-States region at the Network for Public Health Law, and fairly new today, so I'll be fairly new to the network, excuse me. So I'll be serving as a moderator during our panel discussion today, or presentation today, and my research interests with the network are public health data and information sharing, as well as public health authority. Slide. And our presenter today is Sally Millam, who's a deputy director in the Mid-States region, as well as the Network for Public Health Law. Sally is a certified information privacy professional, and her research interests include HIPAA privacy laws, health information and data sharing, and de-identification. Slide, please. And I actually, before I go further into the introduction, I want to draw your attention to the polls feature on the right-hand side of your screen. We created two poll questions that we would appreciate attendees answering, just to get a flavor of how many of you attending represent HIPAA-covered entities and sort of your general level of experience with privacy and data matters. So who are we? The Network for Public Health Law. We are experts in public health law and provide thought on public health and legal law and policy around the country. As I mentioned, Sally and I are from the Mid-States region, and our region specializes in particular in public health data sharing and privacy issues. Slide, please. And the network promotes and supports the use of law to protect the public's health by providing free technical assistance. We develop and provide training, materials, and practical tools for practitioners to use and connect individuals with one another to build a public health law community. And regarding our technical assistance capacity, we provide free technical assistance to any non-commercial entity, again, that's working to improve the public's health. Slide, please. The fine print, as you'll probably see a lot with the attorneys presenting, we are not providing legal advice. This is an educational presentation, and for legal advice, attendees should of course consult with their own counsel. Slide, please. This is our agenda for today, just some HIPAA basics and HIPAA's application to public health law, as well as other legal considerations and how that relates to COVID-19 and data sharing during the pandemic. And before I turn it over to Sally, I want to take a look at our results of our poll. Looks like of folks who've responded so far, 82% are either a fully HIPAA covered or a hybrid HIPAA entity. And in terms of level of experience with legal data and privacy issues, I would say majority are in the middle, moderate, not beginner, but we have a good chunk. Looks like 25% beginner, 25% advanced, and about 50% considering themselves to have moderate experience in this area. So with that, I will turn it over to Sally.
Thanks, Carrie, and hi, everyone. I'm glad that I'm here with you today, and thanks so much for attending this summit with us. So we're going to spend a little bit of time talking through COVID data sharing. Going to focus on some of the FAQs we received really primarily during the start of the pandemic. We started hearing from people across the country, and then it started slowing down, say June, July timeframe. So we'll start with a discussion around HIPAA, because HIPAA is a national law that sets the floor for privacy and security as well. It additionally provides rights for patients, most importantly, access rights. I saw that the Office of Civil Rights which enforces HIPAA, made an announcement yesterday about 5 enforcement cases where they went after HIPAA-covered healthcare providers for not providing patients access to their records. It does apply, HIPAA does apply to most healthcare providers and health plans. And the way HIPAA works is it starts with a general prohibition on data sharing, and then it provides you with a labyrinth of regulations to try to work your way to find a viable avenue to share data. Next slide, please. So HIPAA applies to covered entities, which are healthcare providers that engage in electronic transactions, such as a clinic and a health department, a hospital, a physician, and to health plans such as Medicaid and CHIP. Business associates are all now also covered by HIPAA. A business associate might be your legal department, where they are supporting the clinic and processing protected health information. It could be the accounting, utilization review, quality assurance. So next slide, please. So when you come to a health department, you have to ask, where does HIPAA apply? And I'm not sure, are we on slide 10? Next slide. I think we need to, there we go. So HIPAA applies to health departments differently than it applies to, say, hospitals or physicians' offices, because health plans are not really uniform across the legal entity or the organization. So you have to ask first, does HIPAA apply to the whole health department, to some of the health department, or none of the health department? And we did a survey at the network in 2018 to find out where health departments are in these categories. And we learned that the vast majority of health departments have HIPAA applying to some of their department. Another way to say that is they are a hybrid entity. So likely HIPAA applies to their clinics, but is not applying to their communicable disease programs. Some departments, the minority, are fully covered by HIPAA, meaning their communicable disease programs are also covered by HIPAA. And just a very few are not covered by HIPAA at all. So where a health department is not covered by HIPAA, typically state law will govern data sharing, use and disclosure, and there will be some federal law, other federal law consideration as well. So next slide. As I said, health departments have a variety of flavors. They protect the whole population. They protect the patient. They have obligations around privacy to the patient, but they also have an obligation to the community to be transparent and to share as much information as they can. So it truly is a juggling act. But the bottom line is that a health department must maintain the public's trust. Next slide. So as you approach every data sharing question, you have to figure out what laws apply, to figure out really what you can do. Can you share the information? So you start with HIPAA. Does HIPAA apply? As we just talked about, it may not. And if we're talking about health departments, in the majority of situations, it does not apply to the communicable disease portion of the health department, which is the portion that's collecting the numbers of COVID cases. So if HIPAA does apply, then you also have to look at whether the question, does state law apply too? If your state law applies and it is more stringent, then you need to layer that state law on top of HIPAA, just like that layer cake. And so you might also have to work on making sure you apply both laws. But where HIPAA does not apply, then you only have your state law to follow, and any other law, such as 42 CFR Part 2. We tend to call 42 CFR Part 2 just Part 2, and it applies to substance use disorder regulations, which are pretty stringent and generally require patient consent for onward disclosure. Next slide. So what does COVID PHI look like, or protected health information? Well, A patient's specific test results would be protected information because it would have the patient's name, their address, the date of their test results, likely other identifiers to tie the patient to those specific test results. Additionally, when you look at HIPAA, the name of the employer is also considered protected health information. Now, if we're just looking at state law and HIPAA doesn't apply, state law may not be specific about the name of the employer. However, when you're looking at disclosure risk, you have to look at the size of the employer and make a determination as to whether sharing information about the employer will actually lead to the identification of individuals. So you're not all free when HIPAA doesn't apply. It's still a consideration. HIPAA also limits sharing under the safe harbor rule, which is the typical rule that most health departments comply with, to not being able to share information about any geographic subdivision smaller than a state or for a time period less than a year. And when we're talking about a test result on a specific date, that is certainly a time period less than 1 year. So next slide. So now we're going to move into some of the questions we received through the FAQs, and we're going to start with the public health exception. And when we get to the end of this slide deck, you'll see the resources that we've provided for you. And one of the resources is to our COVID-19 FAQs, as well as sort of a cheat sheet on HIPAA for public health data release. And that you might find that that would be helpful to you as you work through these HIPAA questions. So what is the public health exception? How does that work? Well, when HIPAA was passed, and then the Office of Civil Rights within the Federal Department of Health and Human Services was putting together the HIPAA privacy regulations, they recognized that public health is a mission-critical operation within the United States. Public health is important, and HIPAA cannot and is not designed to impede data sharing for public health purposes. So there is an exception in HIPAA. What that exception does is it allows healthcare providers, all healthcare providers across the country that are covered by HIPAA, to follow state reporting laws and report COVID cases to their health departments. It also allows health departments to utilize that information in case investigation, surveillance. It allows for sharing with close contacts, to another government, to their public health authority, to persons at risk of infection or spreading disease, and finally to avert a threat. Next slide. Disclosures to the media have been a very hot topic in COVID data release, and it really continues to be a hot topic. If the health department is covered by HIPAA, there is really no easy way to do this data release to the media in a meaningful way. HIPAA's safe harbor de-identification standard is not generally helpful because it does not allow you to release, as I said, a geographic subdivision, anything less than a state, unless you hit that zip code exception where you aggregate the first 3 numbers of, or you aggregate zip codes using the first 3 numbers where your aggregation exceeds 20,000 persons. I know that most folks are looking to find COVID cases on county level or smaller, and HIPAA just does not help you get there. We've identified a possible novel emerging legal theory that we've detailed in our FAQs, looking at HIPAA's preemption provisions, arguing that HIPAA's preemption provisions allow state and local public health to operate their communicable disease programs pursuant to non-federal law. They're also, when authorized by law, public health may authorize disclosure of clusters within schools when necessary to prevent COVID spread. And that is specific under public health exception. Next slide. So what about when public health is not covered by HIPAA? This has been a question for a while, and about 9 years ago, ASTO, NACHO, and the Association of Reporters developed some guidance that is still fairly helpful today. And I have a link to the guidance in the slide. Essentially, you want to provide as much information as you can as is allowable by law to be transparent, maintain public trust, but not to breach privacy with any of the individuals who are in the data. This guidance recognizes and recommends that you release as much as you can about the following categories: age, gender, location of victim's residence, underlying conditions, time of disease occurrence, and when public health learned of the case or the death. Next slide, please. So many health departments are receiving FOIA requests. It may be that the media requested information from the health department's policy or law does not allow them to disclose it, and so the health department has received a FOIA request for that information. I have a link to each state's FOIA laws, and essentially a health department, it's wonderful that you follow the guidance that I just mentioned, but in the end, you have to be compliant with all laws, including your Freedom of Information Act laws. So if you receive that request, you need to analyze your disclosure or your proposed disclosure against your jurisdiction-specific law and disclose in accordance with that FOIA law. Next slide. So what information can be shared with family members? HIPAA has a longstanding provision dealing with disclosure to friends and family, and that's the same here. When covered entities such as a covered health department recognizes individuals that are associated in the care with the individual, they can share minimal amounts of information with those close contacts. Additionally, public health can share information through contact tracing to help prevent the additional spread of the disease and to control the disease as allowed by other law, such as state law. And again, it must be the minimum necessary. So let's see, more disclosure to close contacts. And contact tracing, is it appropriate for public health agencies to share PHI of an employee with other employees at the same place of work during the crisis? This question has come up over and over again. HIPAA does allow for contact tracing, which involves sharing some information as that contact tracing progresses. However, minimum necessary applies, and health departments covered by HIPAA or not even covered by HIPAA typically do not share and make every attempt not to disclose the individual's name, age, or job title, and it's really not necessary for contact tracing. In fact, some health departments keep their contact tracers blind as to who the actual infected individual is so that there can be no mistake. However, if you have, say, a health department in its role of employer, and it has information about its own employees in its employer records, that information would be covered by state law and not by HIPAA. HIPAA does not cover employment records. Next slide. So what about releasing the results to an individual's employer? Can a health department do that? And can a health department release those results without patient authorization? Well, the answer is yes, but there is a very specific situation that must occur. It has to be where the health department tests the individual at the individual's employer or as a member of the employer's workforce, and it has to be part of medical surveillance that's required by law. Typically, you see this in place with OSHA, where OSHA requires testing of certain employers. If OSHA doesn't apply in this circumstance with COVID, then you need to look to see if you have a state or local law that requires testing of the employer. Finally, the employer must provide written notice to the employee, and the way a lot of health departments ensure that this requirement is implemented is by posting a notice in the workplace where the testing is occurring. Next slide. Now, what about a health department releasing information to schools? With everybody going back to school, I know that we are getting a lot of questions and there's a lot of interest about schools. So yes, HIPAA does apply. See if it will meet the school's needs by providing de-identified information. If it doesn't, then look to see if you have an exception in HIPAA, or if state law applies, you have an exception in state law. Under HIPAA, a covered entity such as a covered health department is allowed to share information with the school without patient authorization, where it is authorized by state law and they're trying to reduce the risk or spread of COVID. It may be that the health department feels an obligation to provide that information so that schools can decide whether or not to hold in-person classes or otherwise reduce the risk of spread of COVID. Next slide. What about a school releasing to the health department? The school may have information about a student or a parent that is COVID positive. Can they share that information with public health? And the answer is yes. The Federal Education Rights and Privacy Act has an exception, it's called FERPA, has an exception to its parental consent for a health or safety emergency, and COVID-19 definitely falls in that category. You may have a difficult time getting the school to share that information with you, but be aware that that there is a provision in that law, and we do have an FAQ or two about FERPA disclosure on our website. So you can always try pointing the school to the FAQ in the website, or even the FERPA guidance that the Federal Department of Education put out. That may be helpful to you. Next slide. These are resources that we've put together that will point you to the FAQs and other guidance that we've developed around COVID, as well as federal privacy law snapshots. I mentioned the substance use disorder Part 2 regulations. They are summarized at the federal law privacy snapshots, as well as 20 other laws that you might bump into depending on what you're looking at. We also have a legal bibliography that we curate with data across sectors for health that you might find useful, as well as a variety of summaries and resources on all sorts of laws. And then the last resource I included is Health Information in the Law, which is a fantastic data sharing resource for states. There's a map of the United States, and you can click on your state and get more information, summaries, and direct links to laws that apply to you. Next slide. Well, we have concluded the actual presentation part, and let's move on to questions. Thank you.
Our first question, are there links for the resources? I think there's a lot of interest in the links within your presentation, Sally.
Hey, Carrie.
Responding to the chat to say, I think those are all embedded within the slides that will be released in a couple of days.
Hey, Carrie, I think your audio is kind of coming in and out. I know I'm having a little trouble hearing.
Oh, thank you.
Sure.
Is this any better?
Yeah, that's
okay.
better. Thank you.
And our next question is, how do universities fit into the guidelines for information sharing, since they may be a private entity, like in particular private universities?
Sure. Well, private universities are covered by FERPA, unlike private elementary and high schools. Private elementary and high schools are not covered by FERPA, but all higher education is covered by FERPA. Let me add on to that. Wherever you have FERPA apply, you do not have HIPAA apply, and vice versa. So generally, FERPA covers a university. However, if that university also operates a hospital that engages in standard transactions, like submits its claims to a health plan electronically, checks eligibility in a health plan electronically, the hospital component of the university is going to be covered by HIPAA and not FERPA. Do we have any other questions?
No, at this time, I'm not seeing any others in the chat.
Okay. Well, if we have other questions come up, we are doing a Q&A session later today. You can join us. I think it's at 3:30. But why don't we go ahead and we'll turn the presentation over to our next presenter, David Becker. Thank you.
There we go. Hope everyone can see and hear me. Welcome, everyone. Thanks for joining. My name is David Becker. I am the Executive Director and founder of the Center for Election Innovation and Research, which is a nonprofit that works with election officials all around the country of both parties, Republicans and Democrats, all around the nation to help make elections work better. I am a lawyer. I have worked in the field of elections for over 20 years now. I served for many years as a lawyer in the Civil Rights Division of the voting section of the U.S. Department of Justice under both the Clinton and W. Bush administrations. And after that, made my way over to the Pew Charitable Trust, where I ran the elections team at Pew for many years. And in 2016, prior to the election, forged off and founded the Center for Election Innovation and Research, which is a 501c3, and as I mentioned, based here in Washington, D.C. As you might have heard, there's an election coming up. It's made a little bit of news lately, and there has been no question that the pandemic has had a tremendous impact on how elections are run and how voters plan to participate and perceive confidence in the elections. This is something that's been very challenging for everyone that's been working in this field, including groups like mine. Now, I won't have any slides. And that's mainly because things have been changing so rapidly that it really wouldn't have been any point. But I'm going to talk about some of the high-level issues that we're seeing, get into maybe some of the specifics, and hopefully we can get into more specifics during Q&A if we want to. So first of all, as I mentioned, we are 48 days away from the end of voting, not from election day. There really is no such thing as election day anymore. But the polls will close at some point on November 3rd, and that is 48 days away. Now, what does that mean practically speaking? That means practically speaking that basically what we have now is what's locked in place. We do not have the ability to change technology or big issues related to election policy at this point. The rules are largely set, and that's appropriate because honestly, at some point you get to the point where if you change rules, you actually cause more problems, even if those rules changes can be positive. And right now there's a cost to any change, and that cost is usually paid in voter confusion. A presidential election is one in which the largest number of voters in America ever participate. And that means that the largest number of infrequent voters are participating in any presidential election. These are people who might not have voted more than once every 4 years or might not have ever voted. And now you layer the pandemic on top of that, and it becomes very, very challenging for election officials and for voters. So the goals right now for all of us who work in this space and is to make sure that voters can navigate the process as successfully as possible. And this is, of course, challenged by the fact that others have different goals. There are partisans and campaigns whose goal is to try to maximize their chance of winning. Whether that's an appropriate goal or not, I'll leave for others to decide. But that might mean to try to game the system so that they think their voters have it easier or the other side's voters have it harder. And what I do, and one of the things I would suggest on during the session, is that we should work against that noise and try to focus on the voter themselves and making it easiest for them to participate and to navigate the process with success. Of course, as I mentioned, there's a lot of legal considerations that go into this, and there is a lot of litigation going on related to elections in the pandemic. At last count, there was about 200 cases that had been filed all around the country in the vast majority of states. And they include, there are issues like ballot access, and I'm sure you're following the fact that there were recent cases decided in states like Wisconsin, currently pending cases in states like Pennsylvania, that relate to whether or not certain parties, particularly the Green Party or Kanye West, can get onto the ballot. And that is a really big impact on administrative issues in elections, because you cannot print ballots and send them to voters until the ballot has been set. And that's an ongoing challenge. Another big area of election litigation that's going on right now is litigation and policy related to the voting process itself. Whether people can have access to certain ballots, whether they can request mail ballots, how long early voting exists. One of the big piece of litigation that just happened was one in Ohio, where a court just decided that the Secretary of State's decision that there could be only one mail ballot drop box per county was in error, and that counties could feel free to have as many drop boxes as they want. And for those of us who enjoy court procedure and litigation, it's interesting because the Secretary of State has not initially agreed to comply with that declaratory judgment, and the court has issued just today an order to show cause to the Secretary of State to determine whether or not the Secretary of State intends to comply and allow for more drop box locations. The last part of litigation that we're seeing right now relates to the counting and processing of votes. One of the most notable areas of litigation and policy discussions that are going on relate to when states can start processing ballots that come in early, particularly mail ballots, or in some states, early in-person ballots, which are processed much the same way. And there are states like North Carolina, Georgia, Ohio, Florida, Arizona, where they have a lot of time to process those ballots. They can essentially start to process them when they come in, meaning that they're going to be ready to report out results very shortly after the polls close. But in some states, most notably Pennsylvania, Michigan, and Wisconsin, they're not allowed to process those ballots until Election Day under current law. And there's some efforts to try to change that, but that could lead to significant delays in all of those states as they try to process those ballots. So now I'm going to take a step back from the law and just talk a little bit about what we know about the upcoming election and what we might see in the next 48 days. So first of all, what we know is that voters want options. And there's no one option that works for everyone, but the options to vote in multiple ways are going to lead to the greatest chance of success, particularly in a pandemic. The option that's received the most press and discussion to date has been mail voting options. Mail voting, first of all, is something that has a long history in the United States. We've been doing it since at least the Civil War. In 2016, to put it into context, nearly 1 in 4 ballots cast nationwide was a mail ballot. Mail ballots refer to ballots that are received by voters through the mail. It doesn't necessarily refer to the method of return of those ballots. Those ballots can be returned either through the mail or in person, as I mentioned, at a drop box or even at an election office and sometimes at polling places. And in fact, in states with a lot of mail ballots, that's in fact how most of them are returned, in person, usually at drop box locations. Mail voting can be really convenient for people, particularly frequent voters, people who understand the process, people who voted by mail before. And that may be very necessary, particularly for people who are at high risk of contracting COVID-19. However, mail voting has some downside to it. It is voting without a safety net. The voter themselves are putting all of the information validating their identity on the mail ballot envelope. And that information is being reviewed when the voter is no longer there. So if there's any problem, there's a chance that ballot might be rejected. And in fact, we're seeing roughly 4% rejection rates in early mail voting in North Carolina right now, about 1 in 25. So that's something to be very concerned about, particularly with voters who might not be familiar with filling out a mail ballot, because there's a lot of aspects in the mail ballot you need to really follow the instructions on. There's another big challenge with mail ballots, which is that the ballot itself has to be filled out in such a way that you're sure that each of the votes are going to count. With a hand-marked paper ballot like that, voters often make mistakes in filling out a ballot. A very rudimentary mistake might be to put a check mark in a bubble instead of filling it in darkly. So if that happens, that vote will not be registered by the technology that reads these ballots. And that's much less likely to happen when someone is voting in person. So because there's assistance and other protections in place against that. So it's something to consider when voters are considering their option of voting by mail. And then finally, of course, there have been issues with the Postal Service and people's confidence in the Postal Service and whether or not we can rely upon them fully to return voted ballots. And so some voters have lost that confidence and that's entering into their considerations, which leaves us with the options of in-person voting. And a really good option, and in fact, the option that I choose when I vote is early in-person voting. Voting in almost every state, there's some way of voting early in person. These are usually large sites. They're specially designed to be large sites where anyone from a county can go and vote in any of these sites. They allow for social distancing. The voting booths and machines are set up far apart from each other to maintain social distancing. Every single state I've talked to, they are having disinfection. The poll workers are being required to wear masks. There will be hand sanitizer. So there's a lot of protections in place to make sure that voting in person will be safe. And in fact, Dr. Anthony Fauci has said that voting in person should be as safe as going to the grocery store. And I think that's exactly right. In fact, it's arguably going to be even a little more safe because unlike a grocery store where you can't control the flow of traffic everywhere, people can mill about within a grocery store, the flow of traffic within a voting site is very closely monitored. And so there is no milling about. There's no way that people can just hang out in a voting site for 10, 15, 30 minutes close to each other. The flow of traffic is tightly regulated, and so social distancing can easily be maintained. Early voting is far preferable to in-person voting on election day because it is much easier to avoid issues like lines and congestion. When voters wait for the last minute to vote, they get into a situation where they have no other choice but to wait in line because the cutoff is coming, and if the line is too long, they just have to wait. There's no other choice. So you get long lines, you get proximity, other things that are not safe in a COVID environment. And so we're going to need to try to get as many people voting early or by mail as possible so that we reduce the number of people who are voting on election day. To put this into context, in 2016, about half of all voters, just under half of all voters, voted early in some way, either by mail or in person, and just over half voted in person on election day. I expect we're going to see, I hope if we can get to this point, if we can get to around 70 to 75% of all voters voting early prior to the election, with only about 25 to 30% voting on election day, I think we'll be in pretty good shape, even if turnout is as high as we expect it. Another big aspect of this election that's going to be different than past elections, and this is all related to the pandemic, is that we need to set expectations about when election day, when the unofficial election results are going to be available with voters. I mean, with all voters, including myself, we all want to know who won the election as soon as the polls close, and that's really unrealistic. We're going to have about 150 million ballots cast this year, and it's really hard to count all of them in just a half an hour or so after the polls close. So it's really important for all of us to set expectations accordingly. For states that have a lot of mail ballots that haven't seen a lot of mail ballots before, this includes Pennsylvania, Michigan, Wisconsin, North Carolina, Georgia, we're going to need to really understand that that process is going to need to work out. And just because something's taking a long time doesn't mean that there's fraud, doesn't mean that there's rigging, doesn't mean that there's something to be concerned about. It's actually quite the opposite. It means the process is working as it's supposed to, and those election officials are actually validating every single ballot against the voter's record in the voter file to make sure it was appropriately cast and that voter only voted once. That process could take hours, it could even take days. And the biggest variable here will, of course, be the margin of victory. The state with the most ballots that'll be left to be counted post-election actually is going to likely be California, which has a huge number of mail ballots and usually takes weeks to count all of those mail ballots. But the reason we don't normally think of California as an issue is because the margins are so large. But if you start seeing the same rate of mail balloting in states with much closer margins, Pennsylvania, Michigan, and Wisconsin in particular, then it's really a matter of setting expectations in some way to see whether or not we can meet those expectations appropriately, and those expectations should be in several states. That's going to take days. So what to watch for this year with regard to elections? One, disinformation. Foreign adversaries are still trying to interfere in our elections, despite some of the popular conventional wisdom. That interference is largely not about hacking voting machines. That's not a very serious threat. We don't really need to worry about that too much. And election officials are much more on top of that than they were in 2016. But our adversaries and others are very effective at spreading disinformation that will diminish our confidence in the election, perhaps dissuade some of us from participating in an election, et cetera. So with regard to disinformation, particularly with regard to COVID, one of the things we should be watching for are social media and other posts that say things like there are poll workers or voters that are infected at particular polling sites, that imply that voting is unsafe in some way. I've seen well-meaning domestic actors who have said that voting on particular machines is riskier than voting other ways. In fact, I think we've all heard some of the rhetoric that, you know, we don't want to have to choose between our health and our vote when we cast a ballot this year, and so only one way of voting is going to work. Those are damaging narratives, and they're largely untrue, and most voters will be able to choose from a variety of options without choosing between their health and their vote. They'll be able to protect both their health and cast their ballot. And for those at risk, there will be healthy options available to them, including voting by mail. So we should watch for that disinformation. It's going to be ramped up quite a bit. I expect it's going to be one of the major issues that we face throughout this election cycle. And then finally, on election night and the days afterwards, as we try to exercise patience, I think we can expect that we'll see results from states like Florida, North Carolina, Ohio, and Arizona pretty early. Depending upon the results in those states and the margins of victory, it might lead the nation to be able to take a sigh of relief because the presidential election might be effectively decided by those states, but it might not. And then states like Michigan, Wisconsin, and Pennsylvania, we just have to really be patient. That they're doing their jobs. It's going to take days. I expect that Florida, for instance, will have results on before we go to bed on Tuesday night, November 3rd. I expect that Pennsylvania, Michigan, and Wisconsin, you know, we have a shot at getting those results by sunrise on Wednesday morning, November 4th, but it might take a little longer than that. So I think one of the most important things, again, is helping voters navigate the process. And that means two big words: plan and early. Everything you can do, do it early. Check your voter registration status now. You can do it online on your state election website. If you're not already registered or your voter registration is out of date, update that. In almost every state, you can do that online. Request a mail ballot if you need to request a mail ballot and you decide that's the right way to vote. Return that mail ballot as early as you possibly can, unless you need the time to decide on who to vote. Even if you ask for a mail ballot, recognize that you still can vote in person early in every state. You might need to cast a provisional ballot depending upon whether you have it, but there are ways to plan to maximize success here. Go vote early in person if you want. Do it as early as possible. If you show up and there's a line on the first day of early voting, you can come back the second day and you're not risking anything. So there are ways to do this to minimize your proximity to individuals and maximize your chance of healthy participation in the election. I think with that, I'm gonna leave it. I don't know if I have access to all of the questions that I can see, and maybe the host can help me here. I'll leave it at that and open it up to any questions anyone has. I'll stay on for a second. I'm sorry, I'm not seeing any questions. Okay, I got a question. Can you tell us what election officials are doing to make sure the voting machines are not hacked, no tallies changed? Absolutely. So first of all, about one of the key things that's necessary in elections generally is to have an auditable record of a voter's ballot that they themselves have reviewed that you can then check later on against the machine tallies. There are scanners, tabulators that count ballots very fast and very accurately, much better than humans could do, but we rely upon them. And of course, whenever there's technology, there's always the chance that technology can malfunction or be infiltrated. About 75% of all ballots in 2016 were auditable paper ballots that could be reviewed afterwards. But there were several states like Georgia, South Carolina, and Pennsylvania that had large numbers of non-paper ballots that could not be audited. The good news is in 2020, that has changed radically. About 95% of all ballots are paper, including virtually every ballot in swing states like Florida, Georgia, North Carolina, Virginia, Pennsylvania, Ohio, Michigan, Wisconsin, Minnesota, Iowa, Arizona, Nevada. I could go on and on. So, and there are going to be audits of those ballots in most of those states, and I personally work with states like Michigan and Georgia to ensure there will be statewide audits of those ballots. Hacking into voting machines is incredibly hard. It is virtually impossible to do without being detected, but that being said, virtually impossible is not impossible. So having transparent, statistically robust audits is really important. Having paper ballots is really important, and we're in better shape than we have ever been with that, in that regard. I think voters can be very confident that the tallies we get on election night are accurate. What are ways to communicate the safety of mailing in ballots? How do we counter all the misinformation? Are there ways to effectively support our local postal service as well? I think this is really a personal choice for a lot of people. Even before the pandemic, even before the issues that were raised with the Postal Service, the majority of people who vote by mail in states that have a lot of mail voting choose to return those ballots in person. And I think that's because while they trust the mail to send their unvoted ballot to them, their voted ballot has a value to them that they really only trust themselves handing it directly to election officials, either in a drop box or a voting location or an election office. So I think people have to make that own decision. I have a pretty high degree of confidence that as long as ballots are returned, are put in the mail at least 7 to 10 days before the election, that they'll be received by election offices by election day. But look, this is all about doing things early. Don't rely upon deadlines. Don't rely upon postmarks. The best thing you can do is to do this yourself and tell all of your friends and neighbors, get your ballot early, return it in person if at all possible, go vote early in person if at all possible. Those are the best messages right now. Is it possible the Postal Service will deliver your ballot late if you put it in the mail 4 or 5 days before the election? The answer is yes. It might not be highly probable, but it's possible. And so it's important for voters to maximize their chance of success. This is a good question that I might not have a good answer to. Is there any litigation taking place regarding the rights of long-term care facility residents to access voting despite nursing home lockdowns, visitor restrictions, and are nursing homes required to assist residents with mail-in voting? So this varies state by state. I don't know of any litigation currently ongoing about that. So I don't know of any state where a resident of a nursing home cannot vote by mail, including those states where an excuse is required. That's almost always considered an excuse. Age is also, even in Texas, which has very strict restrictions on voting by mail. Older voters are allowed to vote by mail without an excuse. With regard to assisting residents, there is a federal law that requires election officials to allow assistance for anyone that requests it. I don't know of any state laws that require nursing home staff to assist residents with voting. But that's something, if anyone hears of that, certainly I'd be interested in knowing about it. I think that's an ongoing challenge, is how do we allow for at-risk populations, particularly those that might be in nursing homes, to be able to exercise their right to vote? It's a great question. Okay. Here's a question. Facebook and other social media platforms have pledged to fight voter misinformation. How effective do you think they will be? I think there's two aspects of this. The first aspect is promoting good information, accurate official information. And I think on that front, platforms, including Facebook, are starting to do a much better job. If you look on your feed now, you'll see often a lot of voting information. There's a voting information center on Facebook. It's often at the top of the feed. Twitter is providing a variety of services. Other services are as well. So I think there's more and more of an effort to push out good official information. I think the challenge comes to rapidly responding to disinformation that's coming in through those platforms. And I have to admit, I'm a little concerned about their ability to respond quickly enough, particularly on election day, when I expect to see disinformation spread about polling places that have long lines or that have infected individuals, or spreading misinformation about where and how people vote, which is what we often see. That's really hard to find often, and to get it taken down, it usually takes too long. And I think that's one of the things we're going to need to continue to work on. Me and my organization are continuing to work on it. I will tell you also, my organization was one of the recipients of a grant from Mark Zuckerberg and his wife, Priscilla Chan, to provide money directly to the states to help them educate voters. And I think this is one of the really key things, always focusing voters on official information. Local and state election websites in particular. There are a lot of well-intentioned groups out there, political parties, third-party groups, nonprofits that try to be the center for election information for people. I tell people not to go to those sites. Go only to your county or local election website or your state election website for official information. You will never be steered wrong by that. Okay, next. Can you tell us what you think needs to be done to make the counting of mail ballots as safe health-wise as possible? Do you recommend COVID testing for election workers, taking temperatures? It seems that COVID cases could drastically slow down the vote count, especially in the 3 states you mentioned. That's a great question. So I can tell you one of the things we are seeing is, especially in some smaller election offices, the offices have been actually shut down for periods of time because one of the workers in those offices has tested positive. That is a huge challenge for election officials. And then we start introducing poll workers, thousands of poll workers in the process, and you can imagine how the risk is exponentially increases. There's several things that I can tell you that election offices are doing and are going to need to continue to do. One, they are planning out their mail ballot processing sites to allow for as much distancing as possible. And so for instance, this has never been done before. Ford Field, which is where the Detroit Lions play, is a mail ballot processing site. In Philadelphia, the Philadelphia Convention Center is a mail ballot processing site. This has not been done before. Finding huge rooms, they have to do it indoors in most cases, but to find huge rooms where this can be done. And then they are providing PPE and masks and sanitizer and disinfection in all of these sites, and that's going to be very important. You've actually prompted me to ask a little more about what precautions they're taking with regard to monitoring the health of their workers, and whether there's daily questionnaires and whether there's temperature takings and other things like that. I think that's a really good question. You've actually inspired me to ask a little more about that. What is being done to ensure that party objection to mail-in ballots for extremely minor issues like signature having a middle initial? Do you have any suggestions for good resources that universities and or law schools can utilize in an effort to encourage students to vote and increase voters' trust in the process? Yeah, so the first question is a really important one. We are anticipating that campaign operatives may look to gum up the works, slow down the process, challenge a lot of ballots for somewhat ridiculous grounds or on mass grounds in order to basically slow down the process as much as possible. I can tell you that myself and my organization and others are working with election officials right now to think through this. We want to provide for a legitimate and transparent opportunity for challenges where they're justified, as provided by state law, without allowing for efforts just to muck up the works as much as possible and diminish voter confidence. So I don't have anything specific to tell you right now, except that this is something that's ongoing conversation. There's going to be an effort to try to make sure that the process is orderly, that chaos is not introduced to the process, and that all of the campaigns and the parties operate responsibly in this regard. Pennsylvania, for instance, just issued guidance late last week, that said a mismatching of a signature shall not be the sole grounds for rejection of the ballot. In other words, there would need to be something else missing, for instance, on the outside of the envelope for the ballot to be rejected or challenged. As far as good resources, that is a great question. And what I'd say first is go to your state election website. Most cases, it's the Secretary of State. In some states like Illinois, Maryland, North Carolina, it's the State Board of Elections. If anyone has any questions, you can probably reach out to me and ask me. But go to your state election website. There's probably great resources there. I always start with official resources. There are going to be a lot of people trying to target student voters. And I personally, I'm not a fan of the third-party efforts as much, because a lot of it is about data collection as much as it is about engaging with voters. Go to the state websites first, get that information. And one of the important things for anyone who's a student is a lot of students, almost by definition, have multiple places in which they can legally indicate their residence and their eligibility to vote. So they might have a home residence where they lived with their parents, where their parents might still live, as well as a school residence. And in most cases in the states, the requirement for eligibility to vote from a residency perspective is the intent to reside there, which is a fairly loose requirement. So as long as there's an honest intent to continue to reside in that place, most people can legally register, as long as they're only registering and voting in one place. So I would encourage every student out there to be advised, think about where you may be eligible to vote, think about where you intend to reside and want to vote, and then get on that state's election website to find out how you can make sure your registration is up to date, you're registered properly, and what your options are to cast a ballot. Okay, I think that's all I'm seeing right now. I don't know if there's any other last questions. These have all been great questions, by the way. Thanks so much for asking them. Do we want to wrap up?
Yeah, we can wrap up. Thank you so much for that presentation, David. That concludes today's session. Please press the button underneath this video feed in Pathable to take the evaluation for this session. Thank you all for attending, and have a great rest of your day.
Thanks, everyone.